Welcome, everyone. My name is Madeline Desfossé, and I'm with the Public Interest Research Group Education Fund. We are a nonpartisan organization working on vaccine education across the state, and we work on things like consumer protections and public health and maintaining and protecting our environment. We're so excited to have you at tonight's conversation and public forum, which is about young children and the COVID-19 vaccines. Tonight's event is also brought to you by Healthy Acadia, an organization working to build healthy communities in Hancock and Washington counties. Another thank you for making tonight's event possible goes out to the Maine chapter American Academy of Pediatrics, which works alongside Maine's pediatricians to improve the lives of youth in all corners of the state. Thank you both. Tonight we will hear from three experts in children's health. We're so glad to have them with us tonight. And after we hear some opening remarks from our speakers, we will transition to answering audience questions. If you didn't get the chance to submit your question in the registration form before the forum, you can submit your questions now or at any point during the next hour through the Q&A function, which is located right at the bottom of your screen. Looks like two little text bubbles with the Q&A underneath. And we're so fortunate to have such excellent speakers with us tonight. And first we have Alf Wakeman from Downey's Community Hospital. Next we have Julie Redding from the Community Caring Collaborative. And finally we have Dr. Renee Fournier from Northern Light Pediatric Care. Welcome all, and thank you so much for joining us again. Now I'll ask each of you to just introduce yourselves and share one thing you believe parents should consider when making the decision to vaccinate your children against COVID-19. And we'll start with Alf.
Hi, I'm Alf Wakeman, and I do pediatrics for Downey Community Hospital in Machias. And I think that one of the most important reasons to get vaccinated, I feel like that the amount of COVID virus around right now is so high. So I think that either you're making the decision to get infected by the COVID virus, or get the vaccine. And at this point, I think the vaccine is so much safer than actually getting the COVID infection.
Wonderful, thank you. And Julie, we'll kick it over to you next.
Madeline, my name is Julie Redding. I'm the clinical director from the Community Caring Collaborative located in Washington County, Maine. My background is in children's mental health, and I've been a licensed therapist, primarily practicing with kids and their families in home-based settings, outpatient, around Penobscot and Washington counties for the last 15 years. One of the biggest considerations I think parents should be making, or impacts from the global pandemic, has really been the disruption around predictability and consistency that our kids have been missing. Those are really two instrumental factors in healthy social emotional development and adjustment. And those have been tremendously impacted for all of us, but especially for kids as their daily lives are constantly disrupted, whether it be through school, play, lack of access to socialization, when they have to quarantine or when school is shut down. Those have really impacted our kids in ways I think are really important for parents to be considering how we can minimize and build back opportunities for more consistency, more predictability, time with peers, and healthy attachment and play.
Wonderful, thank you for all of that. And Dr. Fournier.
Hi, I'm Renee Fournier. I'm a pediatrician up in Presque Isle, Maine. I've been up here for 23 years. And I've been taking care of all the kids from all of Aroostook County and even south. I think for me, it's obviously multifactorial. I agree with what Alf and Julie both said very strongly. But for me, it comes down to community, and it comes down to needing to really think about protecting your community, your kids in addition, but our kids play a role in protecting their family members and their community members and their younger siblings who may not be eligible for a vaccine. As Alf said, there's so much COVID in the state right now, and we're seeing people getting sicker and sicker from it. And then the final piece for me is we need to keep kids in school. And the only way to keep kids in school right now is to keep them safe and protected and not ill. And that's going to keep them in school in order to get back to the normalcy that Julie was talking about.
Wonderful. Those are all really important things for parents to consider as they make these decisions, which are tough, but worth making. I think we can all agree. So, all right, now we're going to turn to some questions that we had pre-submitted, as well as don't forget that you can always pop in any questions that come up during the discussion in the Q&A chat below. So please feel free to do that, and we will, get to those questions in just a bit. All right, so our first question goes to Alf, and it's kind of probably thing that is top of mind for most parents, and I'm sure you've gotten lots of questions about this in your office, Alf. But if most healthy children don't get seriously ill from COVID-19, why would I get my child vaccinated? And of course, this seems kind of like a two-parter, both in asking about, first of all, can healthy children get sick with COVID-19, and if so, or if not, I guess, what are the reasons that we would vaccinate?
So I guess a couple of things that I think about. One is that there are kids that get seriously ill from the virus, and also can have kind of long-term effects from the virus. I have some in my practice that got sick 6 months ago, and they're still symptomatic with either extreme fatigue or persistent cough. And there's some of these kids that I've had have been, star athletes and, very healthy kids that have never, come into the office sick, that end up with kind of pretty significant illness from the virus. And then the other reason, like Dr. Fournier mentioned, was it helps protect everyone around you. So it helps keep kids in school, helps protect your family, community. And I think that's a huge benefit to getting your child vaccinated, just to help protect everybody around you. Yeah.
Wonderful. Dr. Fournier, do you have anything to add to Alf's remark?
No, I agree. We've had a few children in the practice too that have ended up with myocarditis or cardiac problems after COVID, that has knocked them out of their activities, and made them really not feel well for an extended period of time. The numbers aren't high, and I think that's what's hard for people to wrap their heads around. Most kids are going to get mild symptoms and they're going to feel better in a few days, and but the people they pass it to may not be so lucky, or the people they pass it around the community to, their friends at school, may not be so lucky. We know the vaccines are safe. We also know that COVID has potential to not be in a child. It's all about risks and benefits.
Definitely. Yeah, we don't know which kids will get sick, unfortunately. Exactly. And this next question is for Julie. How has COVID-19 impacted the mental and emotional health of children? And I guess along with that, to what Alf and Dr. Fournier were saying, how can vaccination maybe play a role there as well?
Sure. As I mentioned before, one of the biggest pieces with COVID has just been the disruption to every single part of our life, and especially for kids, whether it be home, school, childcare, extracurriculars, time with friends, events with families, all of those activities or life experiences that we know help shape them, and through tradition and routine, whether it be daily routine or yearly, we're at the holiday season. And so whether it be annual or every once in a while routines, these are the kinds of repetition and familiarity that kids really need to develop a sense of security with the world, that the world is a safe place, it's a safe place to be. That helps us be happy, healthy, stress less adults. What's happened though, we know that when early on in the pandemic, when life as we know it kind of shut down and came to a halt, not only did all of those opportunities for kids to have the structure, familiarity, those all ended, we also know there was has been then and still now tremendous stress for parents. And so as we think about the ways in which kids always social reference their parents, the adults that they trust and they look to be reassured or to be worried, parents who are stressed, whether we try to or not, even when we try to hide our stresses, no matter whether it's around work that's been disrupted. Maybe we've been laid off, maybe we're in and out of work, maybe we've known people who have contracted COVID. And in our small communities, whether it's Washington County or Aroostook County, for those of whom for kids who have lost parents, lost family members, or have known somebody in their greater community, maybe someone they saw at the store, maybe it's friend's grandmother. I'd like to say in Washington County, and I'm sure the same is true in Aroostook, that we're not separated by 6 degrees of Kevin Bacon or 6 degrees of separation. It's like 2.
Yeah.
And so I believe it's a strength for our small communities that we know and care about each other so deeply. But I also believe when it comes to hardship or tragedy pre-COVID or during COVID, that those things add to the sense of vulnerability that parents and adults feel, as well as kids. And so the degree to which kids are experiencing unprecedented levels of stress with the lack of familiarity, inconsistency, and opportunities just to play it out, to have moments to stop thinking about the stresses of life that school and extracurriculars oftentimes afford, being home or being quarantined, and certainly being sick or knowing those who have been impacted all play a role in increasing stress for kids, which we know is not healthy. And as I think about the degree to which we've already experienced a long-term level of stress, we need to start thinking about the way in which toxic stress or prolonged high levels of cortisol, and of course, both the doctors can speak to the health impacts of that long-term, but we know toxic stress, which again is high levels of cortisol in our body, are not healthy for developing bodies, but also brains and minds. So we know that kids are experiencing unprecedented levels of mental health challenges, certainly for those of whom had mental health disorders or challenges or were susceptible to them pre-pandemic, but also kids who have no history of mental health challenges, anxiety, depression, sleeplessness, difficulty eating or sleeping. We know that kids who don't even have a history of that are experiencing them these days. So there's been a lot of impact. I could probably go on forever about my worries for kids in their social emotional health. Certainly, I'll just close here. As families start to consider how they build back opportunities for reducing family stress, increasing consistency, predictability, opportunities for kids to have distraction through socialization, play, routine, time with others, with family. Those healthy distractions from the stresses of the pandemic or life are really what help give kids buffers and help reduce those levels of cortisol and maintain and build back in opportunities for resilience that will serve them throughout the rest of their life once we get to the end of this.
I'm sure that's true for adults too. We could all use a lot more of those distractions and maybe have some coming as the holidays approach. So that's all good to hear. Thank you for that. And so kind of going back to maybe, what you were talking about at the end of your response, Dr. Fournier, about, weighing the risks and benefits. How is the COVID-19 or are the COVID-19 vaccines safe? And, along with that, how do the risks of getting vaccinated compare to the risks of getting COVID-19?
These vaccines are probably one of the safest vaccines we have seen in my career, to be honest with you. It's one of the most scrutinized vaccines we've seen. It's been given in more doses than a lot of the vaccines that we've seen. And that's all data that continues to be collected. And as we're collecting data from more than 2 billion doses given across the world, we're realizing there's not a lot of side effects to these vaccines at all when we look at the numbers. The safety profile, like I said, is up there with probably, it rivals any vaccine that we've used from a data perspective. Side effects in kids, I don't know about you, Alf, but I've not seen a whole lot of kids complaining in the 5 to 11 group about not feeling good after their shots. They're tolerating it a whole lot better than the adults are. And even their second shots, and a lot of them are getting multiple shots at a visit with their other vaccines, and they're tolerating it super well. We did school vaccine clinics last week, and for the second one, and I asked kids how they did with the first, and they said they were fine. They went and played after, and they had no issues. So from a safety profile, I'm super confident the safety of this vaccine, just based on sheer numbers that we've given. As far as the risks and benefits of getting vaccinated versus not, because the vaccine is so safe and because we know this far in that there's the long-term side effects aren't showing up. We do know that we get those long-term effects with COVID. And I think that's the scary part. And I think that's what we need to continue to remind people about, is that the disease itself can cause the long-term issues that we're so concerned about, and has a much higher percentage of causing any issues. We talk about fatigue and we talk about heart issues or the concerns that people have for their kids. And I'd be much more concerned about the the virus causing those issues than the vaccine.
Very interesting. And Alf, do you have any comments to add on to that?
Yeah, I would say with most vaccines, you're going to see side effects within the first couple of weeks.
Mm-hmm.
And at this point, there have been like over 5 million kids, 5 to 11 vaccinated, and over 11 million, the 12 to 17. And so, I think from there, you would see if there's any kind of significant adverse reaction. There's the real rare myocarditis, which with the vaccine seems to be really much less than if you were to get it from the disease itself. As far as kids generally come out of that in a short amount of time and doing well. So I think that's pretty significant that with that number of kids being vaccinated, that we're not seeing a significant adverse reaction.
Mm-hmm. So that might be perhaps a response as well to another current concern, which is, the long-term impacts of vaccination. Can you speak to that, Alf, or Dr. Fournier?
Yeah, I think as Alf said, in the history of all vaccines, long-term side effects to vaccines or side effects that people are concerned will happen years down the road. That's not the way vaccines work. Vaccines work very different than medicines in that sense. So any long-term effects we're going to see from a vaccine happen within 4 to 6 weeks after the vaccine is given. So we've had enough doses given in the under 17 age group now, and even the under 11 over a period of time that's long enough to know that we're not going to see long-term side effects. A lot of these kids got vaccinated more than 6 months ago in the 12 and up group, and we just haven't seen reports of any major concerning side effects at all to this vaccine in the pediatric population.
Wonderful. And you both already kind of, hinted at this, but we had a question about, any common side effects that you've seen from your pediatric patients. And I know you said, they handle the vaccines much better than most adults that but maybe what can parents expect in terms of in the following 24 or 48 hours in terms of just common safe but common side effects that might occur or that you have seen in your patients?
Yeah. Sore arm has been probably the most prevalent that kids have had that lasts for a couple of days. I don't know what you're seeing at your site.
Yep. But not even that, they're not complaining a whole lot about. Like I said, we did the little 5 to 8s the other day, and they're great. They just go on and play. They're not complaining about anything. Yeah. The older we get, the more the complaints post-vaccine seem to ramp up.
Very interesting how that works. And Julie, along those lines, what are maybe the, and I think you already touched on this, but you could just maybe explain a little bit more in depth as well. What are the, effects that the act of vaccination, or maybe you didn't touch on this, my apologies, but are there any effects of the act of vaccination itself that might, detriment or have an impact on mental and social development? I know that's something parents are worried about, is maybe the, that getting vaccinated can be scary, especially for those younger kiddos. And is there any, I guess, mental or emotional impact from that itself?
It's a great question. It's a fair one. Kids don't like pokey things. None of us like feeling uncomfortable or, feeling as if something's painful, whether it's stubbing our toe. Given the age of kids who are eligible for the vaccine, kids ages 5 and up will already have been eligible, and most of them receiving vaccinations for all of their life. And so parents should take note and be thinking about, how has my kid tolerated vaccines? Is it something they're fearful of? Is it something that causes emotional distress leading up to or during the act of? Those are the best indicators of how your kid will handle this vaccine, although there has been so much more talk about this one than perhaps any other vaccine they've experienced to date. That said, for kids who are excited for the vaccine, I think there's an opportunity to celebrate this and to frame this as an opportunity as we think about our self-concepts, and for some families, the value around helping others, keeping others safe, staying healthy. I think those are aspects, whether it be vaccination, masking, the ways in which we think about our health in relation to other people's health is something I think this generation will grow up having so ingrained in them. I'm really excited for the opportunity as they grow into adults, what that will mean for them. But for kids for whom vaccinations have been either distressful, upsetting, those should be signs for parents that you have some work to do. Be thinking, and parents know their kids best. You know what works well for them. Have there been strategies before that you've used in other vaccination for other vaccines? That would be the time to use these ones. Using age-appropriate language to be talking about what you're going to do is always a good idea. And again, you know your kids and what kinds of language is best and that they understand, so that they understand what's happening. For some kids, having a lot of heads up or time to process and anticipate is what they need. Again, if you are a parent who you know your kid should not be caught off guard by going to get a vaccination, that's the time to do some planning and including them either with a calendar countdown, some planning, how many more sleeps until it's going to happen, so that they have a sense, again, if that's good for them. For other kids, thinking about it and who might be anxious about getting any shot, talking about it too early might only make it a little bit worse and make them more anxious leading up to it. So giving them enough heads up, but not so much that it's distressful. They might start losing sleep or becoming worried or preoccupied with how many more time, that worry. That said, I think the setting in which kids get a vaccine, if that's what parents are choosing for their kids, is really important to consider. If there's a vaccination clinic or happening in a school where there's an opportunity for lots of kids to be in an area, if you know your child is one who might teeter or lean heavy towards being anxious or upset about having a vaccination, maybe a vaccination clinic isn't the best setting. Maybe a small, intimate setting with your pediatrician or primary caregiver, where you may not see other kids upset or crying, again, which could set off somebody who's already maybe a little bit nervous or very nervous. So considering, again, what is best for your kid, you know them the best, and setting up opportunities for them to be as least distressed leading up to it. We know that relaxation in terms of pain and the perception of pain really comes from our emotions. So the more worried and nervous I am, the greater negative perception I'm going to have that experience. But if there's one in which a family, and this goes for any setting, not just vaccinations, but if there's an event that my family is celebrating and thinking of very positively, that also helps impact. In the moment, I'll just say a couple quick tips. Distractions, great. I always am in favor of limiting screen time, but if there are opportunities to distract a kid for the few minutes or several minutes they may need to wait until it's their turn for a vaccination, distraction's wonderful for a little screen time. Being ready to offer an incentive or a plan afterwards to celebrate a milestone or occasion for getting it is always good. And certainly the two medical professionals can talk about any medical interventions that might support kids in the actual act of the opportunity.
So I'll jump in, Madeline, here a little bit, because I've been very pleasantly surprised with how kids are going into these vaccines. I don't know if you're seeing the same thing, Al.
Exactly.
It's really been quite eye-opening. Kids want these vaccines. They want to get vaccinated. Their friends are getting vaccinated. They want to be in school. They want to be in activities. They're excited to come for their COVID vaccines. They're excited. They've already got the math figured out of when they're 2 weeks after their second dose is going to be done and when they're fully vaccinated. You know, they're super excited. I mean, we vaccinated 5-year-olds at school with no parents there the other day, and they come in and they sit down and they take their shot and they sit with their friends. I've never seen the likes of this with a vaccine in kids in the past. So the kids understand what it's going to take to kind of get back to a little bit more normal. And I think they want to be a part of it. I think kids are inherently want to help their friends and keep their friends and family safe and their community. And if this is a part they can play and they can be a part of it, they're really kind of embracing this a lot more than I expected. It's been very pleasantly surprising.
Yeah, I've seen the same experience, the couple of vaccine clinics that we've run at the school, some with the parents and some without the parents. The kids have done amazing. They're
Yep.
just coming in and getting their shots and on their way.
Yep, they're excited. They've got their card. They're
Yeah.
happy to be there. So
So, good.
Wonderful. Great. I love the idea of you know, both embracing their inherent nature to be part of the solution, and also, you know, really treating it as a yeah, just as a mentality of how you can keep building that aspect of their personalities and really making sure that they're, you know, taking care of their friends and their community. That's
Yeah.
wonderful. And I remember a school nurse I was talking with earlier last week said that during the vaccine clinics, actually the parents would be there, but all the kiddos wanted to hold onto her hand instead of the
yeah,
parents, which just made me smile to think that, you know, these kids are familiar with their parents, of course, but also with the kids that, or the people that they see as, you know, being safe healthcare providers who they can trust and hold their hands through those tough moments. So takes a village for sure.
that it does.
Wonderful. All right. And so this is kind of a question we had from the audience, and I'll frame it as more of a general question, and then we'll get into this audience question. But can you please explain the difference in vaccine dosages for or doses for different age groups? And we'll kick it off to, you know, Renee, and then Alf, or Alf and then Renee, whoever prefers to go first.
So I get this question a lot. And basically the dosing was determined through the way the studies were set up. So the studies were set up not based on weight, but based on age. And then the parameters within the study included what would be the smallest dose, or the dose that gave the best antibody response on the other end. And, you know, through all of the study criteria, they determined that under 11 responded well to the 10 microgram dose, and 12 and over seemed to respond better to the 30 microgram dose. And I know there's a lot of questions based on weight, but it doesn't work like medication. Medication needs to kind of get distributed through the body, so we base those a lot on weight, you know, body surface area, the whole 9 yards. When we talk about a vaccine, what we really need the vaccine to do is just introduce the template for teaching the body how to respond to the virus into the body. And if a child can form that antibody response to a lower dose, it's not weight dependent. It's based on their metabolism, the way their body's working, their age. And just the way the studies were set up was based more on weight than anything. So, you know, it seemed that the best responses in under 11 seemed to be from the lower dose, and 12 and over seemed to be from the higher dose.
Great.
Would a 12-year-old respond to the lower dose, and would a 10-year-old respond to possibly?
Right.
But the data more leaned towards, you know, the numbers more supported the dosing the way it is.
Right. Gotcha. Wonderful. And Alf, here's a question from our audience that relates to that question. My child is extremely small for her age, due in part to a thyroid disorder. Do I need to be concerned about the dosage since she's smaller than the average size of a 5-year-old child?
Again, no. In general, so if she's in the 5 to 11 age group, she'll be getting the smaller dose, and if she was in the 12 to 17, she'd be getting the larger dose. Younger kids tend to respond or have a better immune response to vaccines than adults, and so, you know, with her being smaller, I mean, right now they're testing the vaccine down to 6 months for approval. And so I don't think you need to be concerned about her weight at all. She should be able to get her age appropriate dose.
Wonderful. Anything to add, Dr. Fournier?
Nope, I agree completely.
Great. Awesome. And, you know, we have lots of questions actually on this. We have another audience question on the same thing, but I won't have you repeat all those wonderful responses. I think they definitely helped me to understand that question as well.
There are questions about if you're 11 and then turn 12. If you get 11, you would get the lower dose for up to age 11, and then if you turn 12, you would get the higher dose on your second dose. Would be the recommendation.
That cusp age is a tricky one,
Yep.
I'm sure, for many parents to wrap their heads around.
Yeah.
Wonderful. One audience member just asked, I've heard there is some research saying that for younger children under the age of 12, the efficacy of the vaccine improves if there is a 4 to 6 week wait between doses. Is that the recommendation at this time?
No, I think the recommendation is still a 3-week window from the first dose to the second. I'll be honest, I haven't seen that data or information anywhere saying we should extend the dosing, but right now the recommendation is to do it at a 3-week interval, and they're responding well.
Great. And many people think that their children are, immune to COVID-19 if they've already gotten sick. But can you please explain the difference between immunity that is, gained from infection from COVID-19 versus immunity that is gained from vaccination? And I'll kick it over to Alf for that one.
So right now, the studies are actually showing that you get a better immune response from the vaccine than you do from the actual disease. And the immune response from the disease, it looks like that might be waning at around the 3-month mark. The immune response from the vaccine is waning more around the 6-month mark. I would say that if your child has gotten COVID, the best immune response is to actually get vaccinated, even if they've had COVID. That'll give their child the best immune response, against the disease.
Right. Would you expect there's a waiting, if a kid has just gotten COVID-19 maybe a few weeks ago, is there a time that you recommend waiting before they get their COVID-19 vaccine, or what would you recommend?
So initially they were thinking, 90 days wait until after the infection, but now they're finding that you can get your vaccine, right after your infection. Usually they recommend waiting until you're not as symptomatic and then get in the vaccine.
Yep.
So it could be, even 2 weeks after, a week or two after the infection, you could still get your vaccine.
We've had kids get their first dose, get COVID within a few days of their first dose, and their 10 days is up, and we bring them back for their second dose right when they were going to be scheduled for it anyway. And they do fine.
That's good to know. That's a great anecdotal piece of evidence there, and also probably backed by the data and the science there as well, of course. Wonderful. And could you explain, maybe any reason why a child should not be vaccinated for COVID-19? We've discussed a lot of the benefits. Are there anything that come to mind, or, when a patient comes in with a certain condition that you would recommend not getting the vaccine? In other words, what other factors elevate the risk of getting vaccinated for children specifically?
Really, allergy to a component of the vaccine is really the only contraindication to the vaccine. We would not know if we had an allergy till that first dose was given. And if there's a reaction, then, we'd reassess. The only other kids I would consider, just maybe speaking to the specialists that follow them, would be children who are severely immunosuppressed or undergoing, chemotherapy or treatment like that. I would say that it would probably be best to consult with their oncologists to determine when is the appropriate time to get the vaccine for them if they're undergoing treatment. I think that the recommendation is still to vaccinate them, but when would be the best time that they would have the best response to it? But other than that, there's really no other diagnoses that would contraindicate a child getting vaccinated.
Yeah, we generally, if they have a high fever, we generally wait
Right.
until that's gone, but that would really be just an acute time frame.
And in terms of, for parents trying to figure out, would they maybe know already if their child is allergic to one of the ingredient components of the vaccine, or would that be something to talk to a doctor or pediatrician about, pharmacist who knows what the specific contents are? What is kind of the process for figuring that out, if that makes sense?
The ingredients to the vaccine are readily available on the FDA site, so a parent could always go look and see what's in the vaccine, and if anything strikes them as having their child haven't been exposed to in the past. There are very few ingredients in these vaccines, which is why they are so safe, to be honest with you, and why we don't see a whole lot of allergic reaction to them, especially on the first dose. So, like I said, the ingredients are out there, and if parents do have concerns, I always tell parents to call. I'll talk through any concerns about COVID vaccines with people. I just want to make sure people have the correct information before they make a decision.
Same here.
Yeah, that's definitely the most important thing. If you have questions, reach out to your pediatrician or family doc, your child's healthcare professional. And I'm sure you're not speaking for, you're representing most Maine pediatricians and family docs to say, please reach out to us and let us provide the information you need that's specific to your child's health.
Mm-hmm.
Yeah, awesome. And Julie, you talked a lot about the ways that we can help children cope through getting vaccinated and before and during. But what advice would you have for parents who are maybe experiencing stress surrounding the decision to vaccinate their children? And what advice would you have for them and suggestions, things to keep in mind?
Yeah, parenting around any topic is really stressful. There was no chapter in what to expect when you're expecting around a global pandemic. And my heart really goes out to all parents, including myself and those who are on the call today. Parenting is stressful, and making these decisions in the best interest of the human being you're raising is a tremendous responsibility. And I'm so glad that parents always take it so seriously. And they, of course, want what's best for their child. I think stress around making decisions around in all aspects of parenting is very normal. So I would say, congratulations, you're having a normal response to, an abnormal life event. This is predictable, right? It's predictable to be stressed about unpredictable things that are not supposed to happen, like global pandemics. So the ways in which I ask, or I would ask parents to consider is, what is the source of the stress? Being as clear with yourself around the tension, what's the pinch point, or what's the topic of tension that I'm most worried about? How articulate can you be around what's stressing you out, what reservations or what concern you have in either direction? Write it down, and then walk away from it, or try to not think about it, and come back and say, can I even be more specific? The more specific we can be with ourselves around any reservation or area of stress can lead us to clarity around how to resolve that level of stress. So if it's around, I'm not sure if my kid's going to have a reaction. I'm not sure what ingredients are in there. As Dr. Fournier said, like, those are questions then, if I can be that specific about my reservation or about my area of stress, you actually know then, or you have the opportunity to create a game plan to get your question answered or to relieve that area of stress. If you're still experiencing stress, I would challenge parents to go back to the drawing board and say, why am I stressed now? What is my reservation? And to be as clear and articulate as possible. Oftentimes, we know that worries can be logical and full of reason, and emotions are also just that. They can be built up and intense, very real. Our responses, like shaking hands and sweating armpits and loss of sleep, are so very real. when actually the source of that stress might be very vague. And we may not have a specific thing that would reduce the stress. So I guess I ask parents to make a game plan, get as clear as you can inside about where your stress is coming from, make a game plan and set a time, set a date or a time point in which you, or a piece of information that would resolve it. So if I'm concerned about the long-term effects, set a date, talk with your doctor, set a date. If it's about, I'm worried about the long-term effects of this, seek out the body of research. Ask your providers, ask all those questions and go seeking for that piece of information. And if you still have reservations, I would say, go back to your drawing board or to ask yourself, is there any bit of information, whether it be from the medical community, from my network of support systems who I love and trust, is there any piece of information that would actually reduce my stress? And if that answer is no, I think that's information for us parents as ourselves to be considering around what's actually holding me back or what is informing this decision to be leaning in one direction or the other. I guess the last piece I'll say is I would encourage parents to really think about what stress is our stress as parents and what stress are we helping build or keep within the environment for our children inadvertently. So the longer they see us in distress, the more likely kids are likely to be in distress or to be on guard. And of course, we know long-term that's not healthy for them. So I think for parents to really reconcile those pieces is important. The last piece I'll just kind of say is making abrupt new decisions about changes or recommendations for our kids is hard. We saw the same thing, and my heart goes out to families who, when the recommendation was to put babies on their backs and don't ever let them, no baby should sleep on their bellies, that took a lot of adjustment. And it was hard for us as parents to wrap our head around a new piece of information that we had never considered before or felt in contrast to the information we had always known or believed in, or that was really kind of tied to our values. The same is true for car seats more recently when the recommendation came to keep kids facing backwards until 2 years old. And lots of us parents said, that's crazy. They need to see what's going on. Their legs can't fit. They'll be cramped. We had all of these reasons. And yet the information, or as parents eventually came around to it or tried it for themselves, and kids naturally acclimated, kids slept on their backs and not on their bellies. 22-year-olds, 22-month-olds did just fine backwards facing. And in fact, we know more kids were able to be saved from being safe that way. So I totally understand the way in which abrupt new information that might be counter to what we've believed or might be counter to some of our values we've had in the past can be hard to process. And so I would just ask parents to be thinking about maybe past experiences in which you've had to make abrupt or sudden unexpected decisions for your kids and how you've gone about doing that.
I'd like to add to that a little bit too, because as stressful as it is for parents to make those decisions, these kids, especially the preteens through teenage years right now, have very clear opinions on this pandemic and on what they can do to help and on getting vaccinated or not getting vaccinated. And I think it's super important for parents to include their kids in the discussion and in their discussion about their fears or why they don't want them to get vaccinated. Every single day, I have a conversation with a 15, 16-year-old who wants a vaccine and his parents say no. But I think that the discussion, I would beg parents to open the lines of communication and open that discussion, because they do have some input and they have some good questions and they have some good points. Make an appointment with your child's doctor with your child and we can all talk through it together. But I think they need to be part of the decision-making process. And I don't think we give kids enough credit sometimes to be able to help parents with that decision. They're living this too. They're living this in school. They're staying home from school. They're missing their friends. They're not able to play their sports. They're not able to be involved in their activities. They have very specific opinions of what can make that happen for them. And I think they need to be part of the discussion.
If I could just add again, that's such a good point. I think when parents are making this and weighing those decisions, what opportunities or what sense of, and I'll kind of go back to what I started with, and this might be controversial, but for parents who don't agree with the vaccination or mandates around vaccination, I would really challenge them and ask them to hold how how much you give weight to those values, which are so important to who we are as human beings. And how do you weigh that against opportunities for your kids to stay in school, to not be bumped from their extracurriculars, to be on the courts, to be able to participate in the plays, in the concerts, and the recitals, to be able to play with friends because they don't have to community quarantine. Those ways in which are there, is vaccination a door opener for kids? And if allowing my child to have more of that consistency, more continued socialization, if that's important to me, and if I value that as much or even maybe more than my other concerns or reservations or mismatch or tension with my values, I would really challenge parents to really be weighing which not which is more important, but how do I give certain weight to those things as they consider it. Sometimes it's the less of which can I live with, or which is going to help me sleep better at night. Which one am I willing to give up here?
Those are really great points from everyone. Thank you for those. And I think, just getting back to what Dr. Fournier said at the beginning, weighing the risks, but also weighing the benefits, and really trying to see there how we can move forward at this point in the pandemic, and all wonderful things for parents to consider. Thank you all so much. All right, well, that concludes our Q&A portion, and I think we've answered most of the questions that we received from audience members. But before we, let everyone go, I just want to do one final sweep around and hear from you all about any, last minute things that you really want parents to consider, and that, main takeaways that you have on child vaccination. So, Alf, you started us at the beginning of our forum. So how about you start with our our goodbyes.
So I really appreciate everybody joining tonight, and thank you for moderating. That was great. I think the bottom line is these vaccines are very safe and effective. And at this point, the CDC continues to monitor the vaccine, and it's I think at this point it's the most intensive safety monitoring of any vaccine in US history. So I think parents can feel really good about that. I do hope that parents, I'll be at a clinic on Wednesday at Machias Memorial High School from 9 in the morning until 6 p.m. Giving vaccines for anyone from 5 years all the way up through adults if they need their boosters. So I do hope that parents come to that clinic, and if they have any questions, I'll be there and happy to answer any questions that parents have. So again, that's at Machias Memorial High School Gymnasium, right up in back of the school from 9 to 6, day after tomorrow, Wednesday. So thank you.
And just a question on that, Alf. How do people need to register, or can they just
No, it's walk in. You can come in anytime between that. Yep, and for all ages from 5 to 100 plus.
Wonderful, thank you.
If parents want to come in and get vaccinated with their kid, they can all do it at the same time.
Big family affair. Wonderful.
Right.
And Julie, we'll pass it over to you.
Thanks. And I would just, again, thanks for the opportunity. And also those who have tuned in to be ever taking in more information, and goodness knows there's a lot of it out there right now. So I always appreciate people who take the time to do that on behalf of them, their families and their kids. I guess I would just go back to doubling down on making a plan if you're still on the fence. Get super specific with yourself around what your reservation is, what your question is, seek that out. Make a time for that, make a timetable or make a plan for when you might do that, and then revisit it and be open to knowing that as humans, we change our minds and we become open to new information. And my parenting decision I made about candy for breakfast most days of the week is not the only steadfast rule, right? Sometimes I make exceptions to that based on different information. And so I would just encourage parents to be thinking about the ways in which we evolve, we make decisions based on lots of different things, but we don't typically stay hard and fast about too much. There's exceptions to everything, and they have a tremendous ability to be role modeling for their kids, how they make decisions, make them with intention, based on values and information, and also being willing to change our perspectives and go back to the drawing board and to say, you know what, I wasn't considering this, and from here on out, or now at this moment, I'd like to take this piece of information into consideration. We're flexible humans, and I think role modeling that emotional and mental flexibility for our kids is also a gift to give them for their lives.
Those are some great points. And yeah, just to remind parents that you don't need to make this decision tomorrow, that you can, still consider this information that you've heard tonight and continue to reach out to your pediatrician and look for other resources to help you along and as you, go through the decision-making process. That's a wonderful point. Great. Dr. Fournier.
Again, thank you again for the opportunity, but pretty much the same here. I mean, I just want people to, we're all tired. I think we're all obviously done with this pandemic. I think we all want it to be over with. And there's some simple ways, so to speak, that we can do that. One of those things is the more people that are vaccinated, the less chance this virus has to continue to change and make more people sick. And eventually will peter itself out if it doesn't have hosts to live in. And that's the goal we need to aim for. And kids can play a role in that. Kids may not get real sick, but boy, do they transmit it. And we want to keep families safe. We want to keep kids in school. We want to keep our community safe. And this is one way that we can kind of move towards that direction. I want to see kids playing basketball with no masks on their face. I want to go to Walmart without a mask on my face. I think we're all in the same boat. So we need to take the steps that help us get out of that. And I understand the fears that people have. I understand the misinformation that's out there, or the confusing information that's out there. Even if it's not misinformation, it's confusing. Talk to your docs. We are here. I will have a conversation all day long with people about their concerns about COVID vaccines, because I want them and their kids vaccinated. I want them safe, and I want them to do it willingly. Keep talking about it, keep having forums like this, keep giving people a place to ask questions. No questions silly, no questions out of line, no concerns out of line, but bring it to us, because we want to be able to help you make the right decisions so we can all be where we were a few years ago.
Great. Well, thank you to everyone who, I would say came out tonight, but that tuned in tonight. And thank you to our three awesome panelists, for all your responses and wise advice. We really appreciate it. And thank you so much. And I guess drive safely or have a great rest of your night. Thank you.
Thank you, Madeline.
Thank you.